Arousal disorder is one of several conditions that fall under the broader category of sexual dysfunction. It can have a significant impact on intimacy, relationships, and overall well-being, making it an important aspect of sexual health. Now, to help us better understand arousal disorder, what it is and how it can be effectively addressed, also why it's important to approach it as a couple, is Dr. Mark Opperman from the T Clinic. So Mark, we've discussed various conditions, but now focusing on arousal disorder, what exactly are we dealing with in this case?
Michael, arousal disorder is where your brain is into it from an emotional perspective, where you get excited, but there's no prize at the end of a line. So for men, it's usually erectile dysfunction.
Right.
It's probably the most common for them. But this can happen in women as well, and it's fairly common. There's a sexual response cycle. It starts with excitement, and then there's a plateau phase, and then you get an orgasmic phase and a resolution phase.
Right.
So it's when you go through everything, you get the excitement, but nothing happens. So there's no physical response to the excitement that's happening.
Now, does that mean that this is a physical condition, or is it still psychologically linked that causes that lack of physical reaction?
Michael, it's actually both. In men, usually it's physical. And you know what, achieving an erection is actually really complex. You need stimulation, whether it's visual, smell, taste. You need that sensation. And then that triggers a hormonal cascade and a neurological effect where the nerves are involved, and that stimulates blood vessels, specifically arteries, to dilate, and then that creates pressure in the sponge tissue, which leads to compression of your venous flow. So now the blood is trapped. So there's so much that can go wrong in that process. And the same for women. Women also has, a reaction to the labia and the nipples, etc., the skin. And when that doesn't happen, you have an arousal disorder.
Right. So fascinating, because when you talk about that cascade of, or that process that happens, it's hugely complex, and I think we don't expect any of that. You think touch, feel, boom, it happens. So it's a very complex thing. So now, Mark, where in that chain of events would there be a hiccup that might cause this disorder to happen?
Michael, it can be anywhere. So arousal disorders. Let's take a look at someone, for instance, that had neurological damage. Either being in an accident, paraplegics, quadriplegics, they cannot have physical reaction to stimulation. But this can also happen after surgery. Radiation therapy, that can damage nerves. Then, there's also a vascular problem. If there's problems in the vascular system, either that it's damaged or that it's clogged, now you can't get good enough blood flow, which can't lead to getting or maintaining the erection. Remember, it's a arterial dilation and a vasoconstriction that happens with pressure. So if anything there goes wrong, blood will either not flow in or continue flowing out. And then certain conditions, diabetes, hypertension, again, depression and anxiety, sensations of guilt or just not being into something or feeling slightly apprehensive will play a role there. And very big, medication that we take for certain conditions. And I think the one that people tend to forget, most people know about the SSRIs for depression and anxiety, but blood pressure medication, and a lot of them, your ACE inhibitors, your diuretics, your beta blockers, all of those can have an effect on getting an erection or getting physically aroused.
Now, Mark, talk to us a moment about the consequence of that. So say you're on medication, it's causing an impact on your ability to maintain an erection or get aroused in any way. Now you start to feel like you're a problem, you've got something wrong. How does that then cascade into a bigger sexual dysfunction?
Easy. So for men, I always equate it to few people actually like having to speak in front of other people, getting onto a stage and speaking in front of other people. So you will do everything to avoid that.
Yes.
When you have an arousal disorder where you are interested but nothing happens, it becomes embarrassing and it creates anxiety. And I'm going to try and avoid that. So now you start avoiding sexual encounters, and in that process you downregulate your libido, your interest and desire. Often in partners, you know, but if there's erection dysfunction in the men, the woman will start developing a low libido because, you know what, they feel inadequate, they don't feel attractive, and, you know what, it's not necessarily just resentment, it's also guilt, and then you start avoiding the encounters, and you have sexual dysfunction in your partner.
Right. So it's so quick to become move from a physical to a psychological challenge.
Absolutely.
So Mark, what would be, apart from the obvious ones, like the inability to be physically aroused, are there other signs or symptoms that you may be dealing with in arousal disorder?
Actually, I think arousal disorder is actually a very big sign of underlying conditions.
Okay.
So again, kidneys, liver, but cardiovascular, really, really big problem. Metabolic disease, and here we've spoken about it on previous seasons, metabolic disease where we have dysregulation of lipid metabolism. So it can point to high cholesterol.
Right.
And diabetes, one of the other ones, and also depression and anxiety, but stress,
Right.
and the one that people forget, sleep.
Absolutely.
Decrease in erection quality or decrease in arousal specifically can point to obstructive breathing or even sleep apnea.
Okay.
So it's a sign of something underlying.
Right, right.
So you need to go and investigate.
Okay. Now let's talk about diagnosis. I mean, obviously there is a very physiological part to this, but how important also in terms of diagnosis and treatment is it to be approaching this with your partner as a relationship unit?
Michael, I think diagnosing it is, you know what used to work for you. You know, men get morning erections. When the quality or the frequency of a morning erection start declining, we need to ask why. Is it maybe prostate? Is it just normal aging? Is it a hormonal thing that's happening? For women, it's the same. You know what, women who don't go through the sexual response cycle, again, hormonal imbalances, but communicating about this, understanding that something is happening, because your partner feels this. For a woman who doesn't get physically aroused anymore, you know what, they don't lubricate. So it becomes uncomfortable. But why are they not lubricating? I think breaking it down into physical and psychological factors, we often see arousal disorders in women who have been a victim of physical or sexual abuse.
Right, okay.
They won't get aroused. It's not a good memory.
Right, almost
And sex is
defensive.
sex is supposed to be pleasurable, and it's something that we should be enjoying. So where there's negative connotations to that, the body will not react.
Right. And in terms of treatment options, I mean, this is, I imagine, quite a holistic process of treatment, right?
Michael, it's easy actually for the guys. Here we can usually get away with prescription medications, depending on the condition. So remember, I said to you, it starts in the brain, and then there's neurological component, there's a vascular component, etc., etc. So your prescription medication works on the vascular component. But if there's been neurological damage, you need to treat it with regenerative medications like platelet-rich plasma therapies, bioelectrical stimulation therapies. If there is a blood flow problem, how do we increase the blood flow by addressing the underlying condition, like addressing cholesterol, addressing the obesity, addressing the diabetes? So it's diagnosis first. It's not give the prescription medication first. For refractive erectile dysfunction in men, we have injectable medication like alprostadil, works very well. I often use it in my patients who had trauma or physical trauma in the area. And then there's not a lot for women, but I think the one that works for most people is optimizing hormone levels and treating the underlying conditions.
Okay, great. Mark, remind us once again, how do we get hold of you if we'd like to find out more?
Easiest, find us on social media under the T Clinic. Our website is www.thetclinic.com, and Alison CJ is available on 010-824-1393 to field any calls.
Wonderful. Thank you so much, Mark. We'll be continuing these discussions next week in our next episode.